Good afternoon, everybody. Welcome to another Thursday, first Thursday of May. Um, we will wait one more minute and then get going for this week. No deep dive today, so it should be pretty quick. Lots of good information, lots of information, some of it not good, some of it good in terms of positive news, but all of which hopefully will be worthwhile for you today. Aloha Corey, aloha Francis, aloha Jim, welcome Lee and Tammy. Hope you guys are all well, and maybe someday we'll have one of these in person. Hopefully in the nearer future. We'll just have to wait and see. Okay, we'll get going. It's the Fab Five today. Hopefully it won't be too long, but if you have questions, hopefully we can answer them. So unfortunately, Japan continues to see a very high surge of cases as evident by their 7-day case average. So once again, continuing to keep an eye on it, especially with the Olympics coming up, and within the Pacific, Indo-Pacific region, we have India, Nepal, Bangladesh, all Maldives, a lot of these countries surging. So just keeping an eye on this particular area. Korea trending down. At one point they were trending up, but hopefully they're getting under control. Their 70 average is much lower than Japan's. And then India, unfortunately, today I think they hit their an all-time high in daily cases and fatalities. So unfortunately, they continue to surge higher than any other country. And unfortunately, some of their national experts are predicting a third wave, and they haven't even escaped their second wave yet. So, unfortunately, we need to keep watching this because it's one of the largest countries in the world, and like we've discussed previously, even with vaccination efforts going relatively well in the United States, this is a global effort, and additionally, India produces a lot of the AstraZeneca vaccines, and that's impacting the COVAX, the WHO COVAX operation. So it has huge ramifications, not just for India, but a lot of the countries that can't quite afford the Pfizers, Modernas, the Johnson and Johnsons of the vaccine world. On a national level, we continue to trend downwards as a country, which is great. And that's great positive news, especially as our vaccination rates are slowing quite a bit. From the state California levels, nothing to be concerned about at this time. And the same with Nevada and Texas, and I believe a few hotels in Nevada opened up this week to pre-COVID measures. So at least Sin City is slowly opening to normal capacity again. At a state-specific level, as you can look, Maui and Kauai are the ones trending up. I know Dr. Berryman has been very busy this past week with a surge in cases, surge once again relative to Kauai, surge for them. And Maui, once again, there was a huge cluster linked to returning travel from a football game on the mainland. So once again, these are examples of, even with our safeguards in place, with the safe travels and increased vaccination efforts, COVID is still going to hang around. So it's still something to be aware of. From a vaccine administration standpoint, numbers, we look good. However, like we discussed last week, at a national and local level, strategies are starting to pivot from a mass vaccination strategy to a targeted, localized and flexible approach to getting shots in arms at this point. No major changes to testing turnaround time. Knock on wood, we don't have a surge, but I think, moving forward, this is a metric we won't have to worry about for the time being. With our Hawaii specific forecast, once again, no major changes. We see a slight uptick, but once again, I think that's well within the range that we are expecting, just because it's really hard to predict any travel related cases, because a lot of those are just random in terms of asymptomatic cases that slip through the Safe Travels program, and then it's hard to estimate the impact of loosening restrictions, and how many people truly are letting their guard down in terms of mask wearing, especially with the vaccination efforts. And then let's see. So the governor approved Kauai's mayor's updated COVID restrictions on gathering sizes as Kauai moved to Tier 3. So once again, Kauai seems to be moving towards a more conservative approach, which is not surprising. 3, and I added 1 at the end, science highlights, kind of differing levels of perspectives. So first one, the President of the United States kind of adjusted his COVID vaccination goal to be 70% vaccinated by July 4th, with a huge target on the younger population. And Jim, is there an explanation for the rising hospital and ICU projections versus the flat case count? Yeah, so that's a great question, Jim. So we're looking at the demographics. So even though the case counts are relatively flat, we still look at what's happened historically. So we're trying to blend projections with what actually occurred on the ground in real life, and we have some hospitalizations, so we're trying to combine the projections with real time, and there is a lag, at least a couple of weeks lag between cases and hospitalization. So if we look back a couple of weeks, we did predict a slight increase, and if you look at what has occurred in Hawaii, you saw an increase in cases. So it's only natural we're going to see the hospitalizations increase due to the previous increases. But what we're looking at right now for the next 2 weeks is nothing crazy in terms of the 2 weeks. So once again, it's not we're not going to see, unless we're in a major spike, the increase going at the same time. Once again, this no problem. This is more of an no matter. And there's an article. The second highlight is definitely more still an art than a science when it comes to forecasting and modeling. So of concern at a national level is, you can see, so the graph on the bottom left shows the vaccination rates, the vaccination average for the country, and you can see we are unfortunately trending down. We're still getting shots in arms, however, not at the rate at the rate we were going, and that's concerning, because that means that experts are hypothesizing we're reaching some sort of saturation point, and if some sort of herd immunity is at 70%, we're not quite there, and we're shooting for July. But if what we're seeing continues to be the case, it may push out even longer. And we checked in with UHERO, and if you go to their website, they kind of project out when Hawaii would reach 70% fully vaccinated. It was early July, now it's pushed to middle July, and once again, there's no fancy metric that they said, but just purely basing it on averages. I think the trend right now is that it's going to be continued to push towards later in the year if we were to reach some sort of 60 to 70% fully vaccinated. And then speaking kind of to Jim, an overall perspective, I think I found this very interesting, a little funny. So this was published in PLOS One, where they looked at they compared the accuracy of experts' predictions versus layperson, and so 140 UK experts versus a little over 2,000 members of the general public, and specifically asked to forecast number of infections, fatalities in the UK, and the worldwide case fatality rate. So the experts were 65 statisticians, 44 mathematical modelers, 35 clinicians, 19 epidemiologists, and 1 virologist. So just, interesting that they focus heavily on the mathematical aspect and statistical aspect, and a little less on the epi aspect, just because, and not just because I'm an epidemiologist, but I just found it interesting that there's oftentimes a lot more context and nuance that's needed than straight up understanding equations. And that's just, no knock on my colleagues. It's just, I think when this came about, everybody, the infectious disease modeling was definitely low on the radar. So, this was a chance for everybody to kind of shine. So I found that breakdown interesting. Not surprisingly, the experts group's predictions fell within the confidence ranges 44% of the time, compared to only 12% of the layperson. So, over 3 times increase of the accuracy in terms of the confidence ranges for the experts versus the non-experts. And then trying to kind of level the playing field of the comparison a little bit more, even amongst the laypersons who had good grasps of numbers. So I'm assuming had a higher propensity for math and for computational aptitude, predictions were only 16% accurate. So once again, just kind of highlighting the need for really expert understanding and the nuances when it comes for this, and then kind of projecting that forward to education and mass understanding and the media. We can see why there were some, especially with social media, why there are big pockets across the world of people who didn't quite believe the severity of what we were going through at the time and what we're still kind of going through right now. So one of the biggest takeaways that I found to be applicable is many, and this applies to me as well. Many COVID pandemic models have proven reasonably accurate in the short term, but not in the long term because of the challenge of the non-linear, rapidly changing nature of the processes influencing viral transmission. So, I think Jim does a great job of keeping us honest. So if we were to look at, Hawaii's epi curve, which, unfortunately I don't have, but even let me just use, for example, the nation's curve. It's, no one would have predicted in the middle of that second surge in August that we would have surged this quickly, or that we would have had these mini peaks up and down. I think we could have guessed kind of what it would look like, but not so much the magnitude. But if we were to, I think if we're in the middle, I know Lee, and then Tom and a lot of our statisticians and modelers who are part of HiPAM, if we were in the middle of this surge, we could have predicted it based on the previous couple weeks. But once again, long-term forecasting requires much more than historical information. It requires looking at policy, human behavior, science, what's coming down the pipeline in terms of vaccinations, mask wearing updates. So a lot of social science also goes into it. And I think that's why even for the experts, 44% is still, that's not a passing grade for, but keeping in mind that things changed so quickly during the past year and a half when it came to COVID, that 44% definitely is really good. And finally, at a local level, but we see this at a national level. So we're, especially with the recent Johnson & Johnson kind of pause for 11 days, there's still a lingering fear of side effects at a local level. There's a recent Civil Beat Hawaii News Now poll. Fortunately, 75% indicated that they already got it. 12% of respondents said they would not get it, and then 5% would wait. Once again, 1,500 is a relatively small sample size. We're talking about 1.2 million residents in Hawaii. but it's the largest survey we've had to date, and it's relatively recent, so it's very recent, so it's capturing the here and the now. Um, and interesting, uh, one of the main concerns amongst those surveyed was the speed with which the vaccines were developed and the potential for an adverse reaction. And it's understandable. I would have thought that at this point, enough messaging, and this was a concern, that the speed of the vaccine development was uh, a point of education that I thought was highlighted, but may possibly we obviously haven't done a good job across the public health sector. But I'm not preaching to the choir. We're preaching to the choir. Everybody knows why it was so quick. Everybody, the entire federal government and private industry through their full weight behind this process. A lot of times it's the red tape that slows down uh, the 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 speed at which a vaccine comes to fruition, and the federal government really did a good job reducing that. Um, Lee calculated if Kauai had India's current death rate, it'll be one death every 5 days. That is quite, from what Kauai has. I don't even know how many deaths they've had. I think Janet would be able to speak to that, but I think they're I think maybe single digits still. Yeah, that's an insane difference. Thanks, Lee, for adding that for a relative comparison. On a slightly positive note, for our state, Hawaii, to launch school-based COVID-19 vaccination clinics. It's a baby step, but it's a positive step nonetheless. Waipahu High School will have some vaccination clinics, and it's May, but I know schools are getting ready for the fall semester, and this is I guess a testing, not a testing, but it's a slow rollout of how to potentially get keikis to get the COVID vaccine once it's been approved, at least for the 12 to 15-year-olds, in the next couple of weeks by the FDA. And other news is expecting, for the younger populations, hopefully by the end of this year, early next year, that our younger keiki can have access. But once again, this is a positive news story, and offering hope so to increase the percentage of the population in Hawaii to get vaccinated. Finally, I just pulled this today because I made the slides last night. I'm sure most of you saw this, but Oahu to keep current pandemic restrictions at tier 3 for at least 4 more weeks. The reason why that's important is based on the guidelines and the policy set by previous Mayor Caldwell. We would have slid back into tier 2, but the governor approved Mayor Blangiardi's request to stay at the current tier for 4 weeks, and it sounds like Mayor Blangiardi is working on, and his administration is working on a amending or updating the current tier system. I know he publicly said he wanted to base it off hospitalizations, fatalities, but no, Dr. Hilton Raytheal from HAH, Hawaii Association of Hospitals, and everybody else who's aware of the data metrics understands why that's not the best reason, because that lags, fatalities and hospitalizations lag quite a bit from cases. And if we were to make any decisions based on rising deaths and ICUs, it might be too late to take a preemptive step. So hopefully they'll find a better way to work and update the tier system so that we can still reopen safely, but do it in a way where we're not compromising what the science and the math says. So with that ends our HiPAM update for this week, and I'll stay on for any questions or comments, and then we'll let everybody go in and hopefully enjoy a nice weekend. Okay, not seeing any questions or comments. Thank you everybody again for attending, and as I get back up to speed from paternity leave, hoping to maybe change it up a little bit, or to bring on more deep dive topics and guests as it is relevant. So once again, I appreciate all of you for being loyal attendees of HiPAM and participants of HiPAM, and hopefully there's still a lot of value that we provide. I know that, you know, things are becoming more and more normal, and COVID is maybe losing its importance, but I think it's going to be around for a while, and we're hoping to kind of shift eventually our perspective from COVID to just more strategic infectious disease and disease monitoring at a whole local and a Pacific level moving forward. So hopefully we'll continue to evolve as well. But have a great weekend, everybody, and we'll see you next week.